Several members of Wisconsin's congressional delegation will be in the western part of the state tomorrow for a hearing on the situation at the VA hospital in Tomah. The Tomah VA has been at the center of a prescription drug abuse scandal, which saw the overdose death of a Marine vet at the VA. The Senate Veterans Affairs Committee held a hearing on Tomah Thursday in Washington. Senators Tammy Baldwin and Ron Johnson attended. They will be in attendance in Tomah tomorrow, along with Representative Ron Kind, Representative Mark Pocan, and our next guest, Representative Sean Duffy of Wausau. Congressman, it's good to have you back on the program. The Tomah VA is not in your district, but you said what? You have a lot of vets from your district who use that facility?
Yeah, so my district goes around the outskirts of Tomah, and a lot of my veterans do go down to Tomah for their health care. So this is incredibly meaningful for the 7th District, which is central, northern, and western Wisconsin.
So what are you hoping to hear? What are you hoping to learn tomorrow?
Yeah, we're going to have a two-panel approach. The first panel is going to be our whistleblowers and those who are working inside Tomah to expose, what was happening. Some of the family members who, lost loved ones at the Tomah VA. So to get the story out from the inside to expose it is job number one. But the second panel, we're going to have employees from the Tomah VA. We're going to have the IG that did a report that didn't disclose that report that could have actually saved lives in Wisconsin, and then some higher-ups within the VA system. What we want to do is make sure that we expose the problem and talk about what solutions we can implement to make sure that the men and women who have raised their hand to serve our country get the care that they've been promised, that they don't go to a VA system and they get substandard care and they don't lose their life on the battlefield, but they lose their life in the healthcare system that we've offered them. I mean, this is unacceptable, and it's these kind of public hearings that I think give the exposure for the necessary changes that the VA system needs to implement.
There are multiple investigations underway right now. Are you confident that there will be change following this hearing, following those investigations?
Well, I think the VA is moving slowly. The Secretary, I think, has been far more aggressive in trying to make the necessary changes. But one of our concerns, Mike, is that in a big organization like the VA or any big organization, you get some bad actors. And the problem is when you have bad actors, like a doctor who is overprescribing drugs and hurting veterans, that you can't fire them. They just get moved from the Tomah VA to a different VA system. They still keep their jobs. We have to be able to have the necessary reform that if you have bad actors in the VA, you got to be able to fire them. You get them out. You just don't move them to a different location where they can potentially hurt other veterans in a different community.
Part of this discussion is about how we treat veterans who come back from various wars or their military service with chronic pain, with post-traumatic stress syndrome. Is that part of what you're looking at, too, that we're doing things properly to address their very specific needs based on their experiences?
Absolutely. And we just can't default to opiate drugs when they have pain. We have to get to the root cause of their issue and not just try to go after some of the symptoms with an easy solution, which is opiates. And Mike, I think it's important as well to note that there are certain procedures and policies that you can put in place to make sure that you don't have an overprescribing doctor in, say, Tomah. Other hospitals have implemented those kind of procedures to prohibit that from happening, but the Tomah didn't have that. I mean, that's why one of our witnesses is going to be someone who worked in the pharmacy in Tomah. And in essence, they were saying, listen, I'm not going to fill these prescriptions. I can see that there's an overprescribing of Dr. Houlihan. I'm not going to fill them. And eventually she was fired because she wouldn't fill those prescriptions. Policies can help save lives, and the Tomah didn't have those policies in place.
You mentioned policy. This issue has also had its fair amount of politics. Do you expect that politics and how various senators responded to these whistleblower reports will be a part of what we talk about on Monday, or is that a discussion that's perhaps best had at a different time?
Well, listen, this has to be about our veterans, making sure our veterans are getting the hearing that can expose the atrocities of the Tomah VA. But you know what? There has been a backstory of the politics, and specifically what Senator Baldwin knew a year ago, and what she did with the IG report, and firing an employee and then paying that person with tax dollars as hush money. That's been a big story. But I think
you would agree, though, that Senator Johnson also has conceded that his office did not pursue this matter as aggressively as it should have.
But with Senator Johnson, he knew late last year and had conversations with Ryan but didn't know early and didn't have the kind of information that Senator Baldwin did. But yeah, both of them have been talking about this. But we have to stick on our veterans and the Tomah VA, and I don't think the politics of Senator Baldwin should come into play in a hearing that is really about making sure our veterans get the care that they deserve. But you know what? That could be a backstory, but we should leave that for a different day.
Congressman Sean Duffy is the Republican from Weston. We appreciate your time. Thanks very much for being with us.
Hey, thanks, Mike.
Next, the latest on the plan to build a new home for the Milwaukee Bucks. What's the holdup? And remember, you can keep the conversation going throughout the week by following me at Mike Boucher on Twitter.